We have discussed the use of epidural steroid injections for treatment of your chronic pain. These injections can be performed in the neck, mid, and low back, and are generally performed for pain that radiates into the arms, around the chest, or into the buttocks or legs. This injection is an injection of cortisone or steroid type medication, and it is designed to decrease inflammation and swelling around the nerves in the spine or as they exit the spine. All procedures that I perform on the spine are done under fluoroscopic guidance, which is a type of live x-ray, and are performed in the Maplewood Ambulatory Surgery Center, which is here in this same building. On the day of the procedure, I can provide an IV and sedation if you request that. Sedation is primarily for anxiety. It does not knock you out. It is not a general anesthetic. It will decrease your anxiety for the procedure and may make it so that you don't remember the procedure very well. The procedure itself is done with you laying on your stomach. A pillow will be placed under your stomach or under your chest depending on the location of the injection. We will ask your name and date of birth to confirm your identity for the procedure. We'll clean off your back or neck with betadine or chlorhexidine and place a sterile drape on the back. I will let you know everything that I'm going to do during the procedure. I then use a small needle to inject local anesthetic into the skin to numb the skin. Once the skin is numb, I place a needle into the spine. Once the needle is in place and the position of the needle is confirmed with x-ray, I will inject a small amount of dye. This part of the procedure can be omitted if you're allergic to dye. Once I've confirmed that the needle is in the correct position, I inject a combination of steroid and local anesthetic, and the needle is withdrawn. This typically takes less than 10 minutes to perform. Once the needle is removed and your vitals are stable, monitors will be removed and you will be taken to the recovery room where we will monitor you for about 30 minutes. Typically, the epidural steroid injection will give benefit within 24 to 48 hours, so typically that night or the next morning. It may take up to 72 hours to see the benefit, but that's less typical. In the past, we used to perform a series of 3 injections at 2-week intervals, but we don't do that much anymore. I still can perform 3 injections in a 6-month time frame, but we typically use 1 at a time, determining whether we do additional injections based on the response to the previous injection. In the low back, there are 3 approaches that I can take to place the needle into the epidural space. If the first injection does not provide benefit, many times I will recommend a second injection from a different approach, as that may be more beneficial in your situation. In the neck and the mid-back, I only perform epidural injections in a single approach, and so if a single injection is not effective, further injections will generally not be offered. In any event, if 2 injections do not provide significant benefit, then further injections are generally not warranted. Side effects include hot flashes, flushing, swelling of the feet or ankles, or mood changes. These are typically due to the steroid. You can have numbness or weakness in the arm or leg for an hour or 2 due to the local anesthetic in the injection. All of these things occur less than 1% of the time and are temporary. If you are diabetic, your blood sugar can be affected for 2 to 3 days, and I ask you to monitor your blood sugar closely. I should also note that if your blood sugar is out of control at the time of the procedure will likely be canceled until the blood sugar is better controlled. If you take a blood thinner, we will need to have you stop that blood thinner prior to the procedure. In order to do that safely, we will contact the provider that monitors your blood thinner and confirm with them that it is safe to stop the blood thinner. Once we hear back from them, we will contact you with the number of days that you need to stop that medication. Please do not stop the medication until you hear from us or from the provider that manages your blood thinner. I do not have you stop aspirin or non-steroidal anti-inflammatories such as ibuprofen, naproxen or Aleve, meloxicam or Mobic, or Celebrex or other similar medications. Serious complications include nerve damage, paralysis, bleeding, and infection, but these are extremely rare, occurring less than 1 in 300,000. However, because of these risks, the FDA in the last year or so has indicated that placing steroids in the epidural space is an off-label use, meaning they feel it has not been adequately studied. I disagree with this. There are numerous studies that support the use of epidural steroid injections. It's something I've done for 20 years, and all insurance companies cover this type of procedure. If you have any questions regarding the procedure, please contact myself or the staff and we'll be happy to answer them.